Lambda Legal and Steptoe and Johnson LLP are suing the Trump administration on behalf of the LGBTQ plus community as a new healthcare rule leaves transgender patients vulnerable to discrimination. The U.S. Department of Health and Human Services announced a new rule earlier this month allowing healthcare providers to turn patients away on the basis of gender identity and sexual orientation. It is set to go into effect on August 18th. Omar Gonzalez-Pagan is a senior attorney and healthcare strategist for Lambda Legal. He's also the head attorney representing the case, and he joins us now. So, sir, how is your group challenging the Health and Human Services newly published anti-trans healthcare rule?
This rule that was published on June 19 really goes against the established case law that has existed for decades, the clear pronouncement by the Supreme Court that discriminating based on transgender status is discriminating based on sex, and endangers the healthcare and well-being of transgender, gender nonconforming, LGBTQ, and patients with limited English proficiency. So for us, it was important to challenge this rule in court immediately. 3 days after its publication, we filed a lawsuit on behalf of healthcare providers, LGBTQ groups with national scope, as well as associations of medical professionals to provide different perspectives to the court about how this rule will harm LGBTQ patients, will deny care to transgender people, and will actually exacerbate problems and divert resources that healthcare providers are now facing in light of the COVID-19 pandemic.
So talk to me about how these changes roll back some of the changes that the Obama administration implemented. And also, I'm curious about what the current administration's argument is for making these changes.
Well, the current administration has for years now been set on an agenda to roll back protections for LGBTQ people, to harm transgender people in particular. This goes back to the revocation of guidance by the Department of Education in February 2017, the institution of the transgender military ban, and this is just part and parcel of those discriminatory acts. The rule as it existed since 2016, really what it did was affirm what was the understanding of the courts and the understanding of those who participate in healthcare and are advocates, that discrimination based on sex includes discrimination based on gender identity, sexual orientation, and transgender status. And therefore, you cannot deny insurance for gender-affirming care. You cannot mistreat, misgender a transgender patient when they seek access to a hospital or the emergency room. And by revoking those provisions from the rule, the revised rule actually invites discrimination against LGBTQ people and harms patients that already face disproportionate barriers to accessing care.
So what are some of the next steps here, Omar?
Well, we're in the midst of preparing a motion now to the court to stop it from taking effect in August. It is our goal to do that in a way that this rule never becomes effective. We already did that successfully last year when it came to the conscious rule that HHS tried to promulgate. We had it enjoined in the courts and it's now on appeal, and we will seek to do the same thing here. We want to make sure that people's access to care, particularly during a time of public health crisis like this COVID-19 pandemic, is not diminished or in any way harmed.
So this rule will allow doctors, if they felt so, to deny services to members of the LGBTQ community, particularly we're talking about trans members here. So the counter argument is, we'll just see another doctor who's comfortable with this. What do you say?
Well, the problems with all of that is that, one, healthcare is a human right. It is a basic need. Sometimes you don't get to choose your doctor. You're taken by the ambulance to a particular hospital. That's one example. For another, many people, particularly LGBTQ people in rural areas, do not have access to an array of providers. They only have 1 or 2 hospitals that are available to them. And it is also true that 1 in 6 hospital beds in the United States are in Catholic hospitals. So based on all of that, really what this does is exacerbate discriminatory barriers to healthcare for LGBTQ people, and particularly transgender people of color. And it really does endanger lives and the public health at large. When people face discrimination, they are less likely to go to a doctor. When they fear discrimination, they're less likely to seek care when they need it. And that is so important right now when we're facing a public health pandemic.
Such an important point that you make there, Omar. And I should point out for our audience to know that this isn't the first lawsuit that Lambda Legal has fought or has brought against the Trump administration's discrimination against the LGBTQ community. Are there similarities here, and has Lambda been successful in the past?
Absolutely. We have an incredible track record of expanding the recognition of the rights of LGBTQ people with regards to marriage equality, the Lawrence v. Texas case 17 years ago. Even now, the cases that were decided with regards to employment, we were arguing those cases in the Court of Appeals for a long time. But also, currently in combating the discrimination and the relentless attacks from the Trump administration. We have stopped the conscious rule from taking effect in the courts. We're battling the transgender military ban. We have sued HHS another time for the non-enforcement of non-discriminatory regulations, and that suit is also pending. So we believe we have a track record that really helps us serve the LGBTQ community and people living with HIV, and it is part and parcel of who we are as an organization. We're the community's lawyers.
I just want to ask you a quick question, because I know that there are going to be people who hear you and say, what about my rights? What about if I feel uncomfortable with serving or servicing a member of the LGBTQ community? How, I should be able to say no. So I want you to talk a little bit about what the Trump administration has been doing and how they have been trying to define or limit the definition of sex discrimination and how it impacts the community that you represent.
So the Trump administration has tried to enact a narrow view of what sex means, one that is divorced from medical understanding, the legal understanding. And even if you accept that definition, as the Supreme Court held, discrimination based on transgender status is still a form of sex discrimination. But going to your question of why other people may say, well, what about my right to discriminate or my right to not serve somebody? And the answer is that there is no such right. When one enters the marketplace, one has to abide by general applicable laws that apply to every person equally. And more importantly, when it comes to healthcare, discrimination is anti-ethical to the standards of care that doctors and healthcare providers must follow. Discrimination is anti-ethical to those very ethic and oaths that they take in order to engage in the healthcare profession and save lives. It is contrary to the do no harm mantra to actually seek to discriminate against somebody or deny them care because of who they are.
All right. Omar Gonzalez-Pagan, thank you so much. Appreciate you spending time with us.
Thank you. Thank you for the opportunity.